Welcome to another deep dive, everybody. And today we're going to be talking about the potential of medical marijuana.
Ooh.
We've got some really diverse sources here today.
Sounds exciting.
Some expert interviews, some research summaries, and we even have some personal anecdotes.
Ooh.
And our goal here isn't to tell you if marijuana is good or bad.
Right.
We're just going to unpack the facts, the benefits, the risks, and all the debates surrounding the use of marijuana in the medical field.
Yeah, it's certainly a hot topic.
Yeah, it is.
Especially right now.
Especially right now.
With the legal landscape changing so rapidly.
Yeah, exactly.
And it's really a mix of opinions and evidence emerging.
Yeah.
So unpacking all that is really crucial.
Yeah, so let's start with a recent development.
Okay.
The DEA is proposing to reclassify marijuana from a Schedule 1 to a Schedule 3 drug.
Interesting.
Can you explain what that actually means for our listeners?
Sure. The U.S. drug scheduling system basically categorizes substances based on their potential for abuse and their accepted medical uses. Schedule 1 is the most restrictive category.
Okay.
And that means the government considers the drug to have a high potential for abuse and no accepted medical use.
So where does that put marijuana?
That's where marijuana has been until now.
Wow.
It's where heroin and LSD are.
So this reclassification to Schedule 3, that's a pretty huge shift.
Absolutely, it is.
In how the government is viewing marijuana.
Yeah. Schedule 3 includes drugs like ketamine and anabolic steroids, which do have recognized medical applications, but they also carry a moderate to low risk of dependence.
Okay.
So moving marijuana to this category acknowledges that it may have legitimate medical uses.
It's interesting because it's legal in some states, but not federally.
Right.
So how will this reclassification affect patients who are already relying on it?
That's where it gets interesting.
Okay.
This reclassification could lead to more funding for research into medical marijuana, potentially make it easier for patients to access.
Okay.
But it's important to note that marijuana would still be illegal at the federal level for recreational use.
Gotcha.
So we've got this complex situation where state and federal laws are conflicting.
Yeah.
And that creates uncertainty for businesses and patients alike.
So it's a step forward, but there's still a long way to go.
Right.
Now, you mentioned research.
Yes.
And one of our sources is a Today Show Australia segment featuring Dr. Rahul Jandil. And he's a neuroscientist who seemed pretty excited about a study published in the New England Journal of Medicine.
Yes, that was a good one.
What was so groundbreaking about it?
Well, this study focused on the effectiveness of CBD in treating epilepsy in children. And it's considered groundbreaking because it provided that rigorous scientific validation. For a long time, a lot of the support for medical marijuana was based on anecdotal evidence. But this study went beyond that. It moved beyond that. And it showed, the effectiveness of CBD in a really controlled setting.
Yeah, that's incredible.
It is.
Now, what exactly are CBD and THC?
Okay, so marijuana contains hundreds of chemical compounds.
Wow.
But the two main ones that everyone's talking about are CBD and THC. So THC is the psychoactive component that causes the high. While CBD offers therapeutic benefits without the psychoactive effects.
Oh, okay. So if someone's concerned about getting high, they could use CBD products without that worry.
Exactly.
That's really cool. So
yeah, and this distinction is important because it allows for more targeted treatments. So, for instance, CBD is being studied for its potential to reduce inflammation, which could help with conditions like arthritis, while THC is being investigated for its pain-relieving properties.
Oh, so they both have different...
Yeah, they have different benefits. They work a little bit differently.
So I'm curious, how do these compounds work in the body?
Well, both CBD and THC, they interact with our body's endocannabinoid system, which is a complex network of receptors and neurotransmitters that play a crucial role in regulating a wide range of physiological processes.
Oh, wow.
For example, CBD interacts with CB1 receptors in the brain, which are involved in mood and pain perception, while THC interacts with CB2 receptors, which are found throughout the body and play a role in inflammation.
Okay, so it's not just about getting high.
Right.
There are specific mechanisms at play that explain why it could be helpful.
Yes, exactly.
Now we've got a source that takes us beyond the science a little bit and into the real-life experiences of people using medical marijuana. So it's a segment from France 24 about seniors embracing cannabis.
Interesting.
Tell us about Brenna, the 87-year-old woman who uses cannabis to treat insomnia and rheumatism.
Brenna's story is a great example of how medical marijuana can provide relief where other treatments have failed. So she was taking Vicodin for her pain, but it wasn't very effective, and it had side effects. So she switched to cannabis. And she found that it helped with her pain and insomnia.
Wow.
Which allowed her to get off the painkillers.
That's incredible.
It is.
So it's interesting to hear how someone from a generation that might have traditionally been opposed to marijuana is now embracing it for health reasons.
Exactly, yeah. We're seeing that more and more.
Okay, so is this a growing trend among seniors?
Absolutely. We're seeing more and more seniors turning to cannabis for pain relief and alternative therapies. Many of them, like Brenna, they prefer those CBD products that don't induce a high. So they're able to experience the therapeutic benefits without the psychoactive effects.
So this isn't just a fringe movement.
No, not at all.
It's like a significant demographic.
Yeah, and it speaks to the evolving perceptions of medical marijuana and the growing recognition of its potential benefits.
Now, while Brenna's story highlights the positive side, we need to address the potential risks associated with marijuana use, especially for young people.
Yeah, definitely.
So what are some of the concerns that have been raised?
So one of our sources is a segment from CBS New York that features Dr. Nidhi Kumar. And she's a physician, and she warns about the potential negative impacts of marijuana on brain development in individuals under their mid-20s.
Wow.
So her concerns highlight the importance of understanding that while marijuana may offer benefits, it's not a harmless substance, especially for developing brains.
What specific risks should young people be aware of?
So Dr. Kumar points out that repeated exposure to marijuana during adolescence and early adulthood can lead to several risks. These risks include potential decrease in IQ, reduced academic performance, increased risk of developing mental health issues like anxiety and depression. And there's also a concern about the potential for developing substance abuse disorders later in life.
So while medical marijuana holds promise, it's not something to be taken lightly. Especially for those younger individuals.
Exactly. It's crucial to approach its use with a balanced perspective. Understanding both its potential benefits and risks.
Now, speaking of risks, one of our sources, a YouTube video titled Addiction Mindset, specifically addresses the potential for addiction. What are some of the takeaways there?
Well, the video emphasizes the importance of recognizing both the benefits and drawbacks of marijuana use. So while it can offer relief and therapeutic benefits, it's also crucial to be aware of its addictive potential and approach its use with caution and responsibility.
That leads to a question I think our listener might have. How does the addictive potential of medical marijuana compare to that of commonly prescribed painkillers?
That's a complex question. And the answer depends on a lot of factors, including the type of marijuana used, the individual's genetic predisposition to addiction, and their history of substance use. So while marijuana is considered to be less addictive than some opioid painkillers, it's not without risk. And it's important to use it responsibly and under the guidance of a healthcare professional.
So it's about weighing those potential benefits against those potential risks. And making informed decisions.
And it's also about recognizing that individual responses to medical marijuana can vary widely. What works for one person may not work for another. It's important to find the right dosage and delivery method.
That's a good point.
That's most effective and safe for each individual.
It sounds like personalized medicine is key here.
Absolutely. It's about tailoring treatment to each patient's needs. And that requires open communication with healthcare providers and a willingness to experiment and adjust.
Now, we've touched on a lot of aspects of medical marijuana, from the science and the legal landscape to the personal stories and the potential risks. I think our listeners are starting to get a sense of just how complex this is.
It is complex. And one of the things that makes it so challenging is that our understanding of medical marijuana is constantly evolving.
Right.
New research is emerging all the time.
Yeah.
It's challenging our preconceived notions and expanding our knowledge.
It's like we're still in the early chapters of this story.
Right.
And there's so much more to unfold.
Exactly.
That's what makes it so fascinating.
It is.
Before we wrap up this first part of our deep dive, I'd like to bring up another important aspect of this conversation. The FDA's approval of specific cannabinoid-based medications. Can you tell our listener a bit more about these medications?
Sure. While the marijuana plant itself may not be fully endorsed by the FDA, specific applications of its components are scientifically backed. For example, the FDA has approved medications like Marinol, Syndros, Sesamit, and Epidiolex to treat various conditions like nausea, vomiting, loss of appetite, and seizures.
So even though marijuana as a whole isn't FDA approved, certain isolated compounds derived from it have been rigorously tested and approved for medical use.
Exactly.
This adds another layer of complexity, doesn't it?
Yeah.
We have this tension between the plant itself, which has a long history of use, but isn't fully approved, and these specific compounds that have gone through the FDA approval process.
Right, and it highlights the need for continued research to fully understand the benefits and the risks of both the whole plant and its individual components.
This is definitely a topic that requires careful consideration and a nuanced understanding of the science, the law, and the individual experiences of people using medical marijuana.
It's a lot to take in.
It is.
Yeah.
We'll continue to explore these complexities in the next part of our deep dive.
Awesome.
So stay tuned.
Yes, please do. It's interesting to think about how our discussion of medical marijuana kind of connects to this broader cultural shift we're seeing. You know, older generations who grew up during the height of the war on drugs often view marijuana very differently from younger generations.
Yeah, it's like we have those old reefer madness propaganda films on the one hand, and then on the other hand, you have modern documentaries about, medical marijuana helping people with chronic pain and stuff.
It's amazing how much perceptions have changed.
It really is.
And this generational divide isn't just about, like, differing opinions. It's influencing policy decisions, consumer trends, investment opportunities. It's really a powerful example of how societal values can actually shape our approach to healthcare.
Makes you wonder, like, what other factors are at play here?
Yeah.
Is there a growing distrust of big pharma and like a desire for more natural or holistic treatment options?
Those are great questions.
Yeah.
And they highlight the need to consider the broader context in which medical marijuana is emerging. It's not just a scientific debate. It's a reflection of evolving societal values, economic forces, and individual choices.
It's like a cultural tapestry with all these different threads contributing to the overall picture.
I like that.
Now, speaking of threads, let's go back to the science of CBD and THC. We talked about how they interact with the endocannabinoid system. But I'm curious to learn a little bit more about the specifics.
Sure.
Can you give our listeners a deeper dive into how those interactions actually work?
Of course. So when we talk about the endocannabinoid system, we're talking about a complex network of receptors and neurotransmitters that are found throughout the body, in the brain, the immune system, organs, connective tissues.
Wow.
And this system plays a crucial role in regulating a wide range of physiological processes.
Wow, that's a lot of responsibility for one system.
It is.
So how do CBD and THC fit into all of this?
Okay, so both CBD and THC interact with the system. But they do so in different ways. For instance, THC binds directly to the CB1 receptors in the brain, which are involved in mood, pain perception, and memory. And this binding is what causes the psychoactive effects.
The high.
Yes, the high.
So that explains why THC can make people feel euphoric or relaxed. But it also explains why it can sometimes cause anxiety or paranoia.
Exactly. It's all about how THC is interacting with those receptors in the brain.
Gotcha.
Now, CBD is a little bit different. It doesn't bind directly to the CB1 receptors in the same way that THC does. Instead, it seems to modulate their activity indirectly. And it also interacts with other receptors in the endocannabinoid system.
So CBD is more of a subtle influencer?
Yes, that's a great way to put it. Kind of works behind the scenes to tweak the system rather than taking center stage like THC.
Okay, I like that.
And because of this different mechanism of action,
yeah,
CBD doesn't produce those psychoactive effects of THC.
Right.
Instead, it's being studied for its potential to reduce anxiety,
Okay.
inflammation, and pain, all without the high.
No, we've been talking about the potential benefits of medical marijuana.
Yes.
But it's important to acknowledge that there are risks, too.
Right.
We already discussed the concerns about brain development in young people and the potential for addiction.
Yes.
Are there any other risks that our listeners should be aware of?
While marijuana is generally considered to be safe for adults when used responsibly,
Okay.
there are some potential side effects to be mindful of.
Okay, like what?
These can include dry mouth, increased heart rate, dizziness, impaired coordination, and in some cases, anxiety or paranoia.
Okay.
Especially with high doses of THC.
So it sounds like moderation is key here.
Absolutely.
Just like with many things in life.
And it's also crucial to remember that marijuana can interact with other medications.
Oh.
So it's essential to talk to your doctor if you're considering using it.
Right.
Especially if you have any underlying health conditions.
Speaking of doctors, what role do healthcare professionals play in the use of medical marijuana?
Ideally, healthcare professionals should be involved in every step of the process.
Okay.
From evaluating whether medical marijuana is appropriate for a patient's condition to determining the right dosage and delivery method.
Okay.
And monitoring for any potential side effects or interactions with other medications.
So it's not just about going to a dispensary and picking up whatever sounds good.
No, not at all. Yeah.
It's about working with a healthcare professional.
Yes.
To develop a personalized treatment plan.
Exactly. Just like with any other medication. Responsible use of medical marijuana requires professional guidance and careful consideration of the benefits and the risks.
Now let's switch gears for a moment and talk about the different ways that medical marijuana can be consumed.
Okay.
What are some of the options available?
There are several ways to consume medical marijuana.
Okay.
Each with its own pros and cons.
Okay.
Smoking is the most traditional method.
Right.
But it can be harsh on the lungs.
Yeah.
Vaporizing is a gentler alternative.
Okay.
It heats the marijuana without burning it.
Right.
Releasing the active compounds in vapor form.
Okay.
Edibles, like brownies or gummies.
Yeah.
They offer a discreet and longer-lasting effect.
Okay.
But it can be harder to control the dosage with those.
So there's a lot of variety.
There is.
Which is good, because patients can choose the method that works best for them.
Exactly. And there are also topical products, like creams and lotions.
Oh, wow.
That can be applied directly to the skin.
Okay.
For localized pain relief.
So this all ties back to the idea of personalized medicine.
Yes.
Finding the right product and delivery method for each person's needs.
It is.
And it's important to remember that the effects of medical marijuana can vary depending on the method of consumption.
Yes. For example, edibles tend to have a delayed onset and a longer duration compared to smoking or vaporizing.
So it's not just about what you're consuming, but how you're consuming it.
Right.
It's all about finding that balance.
Yes, and that's where working with a knowledgeable healthcare professional can be so valuable.
Right.
They can help you navigate the options and make informed decisions.
Now, we've been focusing a lot on the medical applications of marijuana.
We have.
But it's important to acknowledge that there's another side to this conversation.
Yeah.
The recreational use.
That's right. And while our focus here is on the medical aspects, it's impossible to ignore the fact that recreational use is becoming increasingly common and accepted.
Right. A lot of states are legalizing it.
Many states are legalizing it for adults.
So that brings up a lot of questions about the intersection of medical and recreational use.
Yes, it does.
Like, how do we differentiate between the two?
Right.
And how does legalization of recreational marijuana impact the medical marijuana industry?
Those are complex questions.
Yeah.
And the answers are still evolving on a basic level.
Yeah.
The distinction between medical and recreational use comes down to intent.
Okay.
Medical marijuana is used specifically for the treatment of a qualifying medical condition.
Okay.
While recreational use is for personal enjoyment or relaxation.
That makes sense.
Yeah.
But I imagine the lines can get a bit blurry.
You're right.
Especially in states where both medical and recreational marijuana are legal.
You're absolutely right. And that's where regulations and oversight come into play.
Okay.
In states with legal recreational marijuana, there are typically separate systems for medical and recreational dispensaries with different rules and requirements for each.
So there are efforts being made to maintain some separation between the two markets.
Right, even though there's bound to be some overlap.
And it's important to remember that even in states where recreational marijuana is legal, there are still regulations like age restrictions and limits on the amount that can be purchased.
Exactly.
So navigating the world of marijuana, whether for medical or recreational purposes, requires a good understanding of the laws specific to your location.
And as with any substance that can impact your health and well-being, responsible use is key.
Now, let's shift gears again and talk about the future of medical marijuana with all the advancements in research and the changing legal landscape. What you think the future holds?
I think the future of medical marijuana is incredibly exciting.
I agree.
As research continues to uncover the therapeutic potential of cannabinoids, we're likely to see even more targeted and effective treatments for a wider range of conditions.
That sounds promising. Are there any specific areas of research that you're particularly excited about?
One area that's generating a lot of buzz, the potential for personalized medicine.
Oh, wow.
Using cannabinoids. Researchers are exploring ways to tailor treatments to individual patients based on their genetic makeup and the specific characteristics of their condition.
So moving beyond a one-size-fits-all approach.
Exactly.
What about the legal landscape? Do you think we'll see more states legalizing medical or even recreational marijuana?
It's certainly a possibility. Public opinion is shifting. We're seeing more and more states recognizing the potential benefits of marijuana, both medically and economically. However, there's still a lot of work to be done at the federal level to create a more consistent and rational approach to marijuana policy.
It's clear that the conversation about marijuana is evolving rapidly.
It is.
It'll be interesting to see how these developments shape the future of this field.
Absolutely. It's a fascinating time to be following this topic.
Yeah.
I think we're just scratching the surface of what's possible with medical marijuana.
And as we continue to learn more, it's crucial to approach this topic with an open mind, a critical eye, and a commitment to responsible use.
Well said. It's about finding that balance between exploring the potential benefits while acknowledging and mitigating the risks.
As we've been diving into this topic, I've been struck by how many different angles there are to consider. We've got the science, the law, personal experiences, the cultural context.
It's a lot.
It's a lot to unpack.
It is.
And that complexity, I think, makes it even more important to have these conversations, to really try to understand all the nuances.
I agree.
So, for instance, we touched on the FDA's approval of certain cannabinoid-based medications. And that just seems to add another layer to this whole debate.
It really does, On the one hand, you have the marijuana plant itself, which has a long history of use, but isn't fully endorsed by the FDA. And then on the other, you have these isolated compounds that have gone through that rigorous testing and been approved for specific medical uses.
So for our listener who might be thinking, wait, so is medical marijuana approved or not? It's not a simple yes or no answer.
It's not a simple yes or no. It really comes down to specifics. The FDA evaluates medications based on their safety and effectiveness for treating particular conditions. So while the whole marijuana plant hasn't gone through that entire process, certain compounds derived from it have been proven effective and approved for specific uses.
So it's like we're still figuring out the full potential of the whole plant. But in the meantime, science has isolated some key components that we know can be helpful.
Exactly. And that's why that ongoing research is so crucial. The more we learn, the better we'll be able to harness the power of marijuana for medical purposes while minimizing any risks.
Now, for our listener who has been with us this whole time, taking in all this information, what are some key takeaways they should keep in mind?
I think first and foremost, informed decision-making is paramount. If you're considering medical marijuana, do your research, consult with healthcare professionals, and be aware of both the potential benefits and the potential risks.
Right.
It's not a miracle cure, and it's not for everyone.
So it sounds like a lot of personal responsibility is involved.
Absolutely. It's about being proactive in your healthcare journey, advocating for yourself, and making choices that align with your needs and values.
Now, we've covered a lot of ground in this deep dive.
We have.
Is there anything else you'd like our listener to reflect on?
Yeah, as a final thought, I'd like to pose this question. How might the increasing acceptance and accessibility of medical marijuana reshape our approach to healthcare in the years to come?
That's a great question.
Will it become a mainstream treatment option alongside traditional pharmaceuticals? Will it challenge our current views on pain management and mental health?
It's definitely something to think about.
It is. Only time will tell, but it's fascinating to consider.
It really is, and it's a reminder that this is an evolving field and the conversation is far from over.
Absolutely.
We encourage our listener to stay curious, stay informed, and continue exploring those sources we discussed.
Well said. The more we learn and share knowledge, the better equipped we'll be to navigate this complex and ever-changing landscape.
Well, that brings us to the end of our deep dive on medical marijuana.
It was a good one.
We hope you found it informative and thought-provoking.
Yes.
Until next time, happy diving.